You're watching 22 News in Focus. Today we are talking about taking care of your mental health during the COVID-19 crisis with Kimberly Lee, Vice President of Resource Development and Branding for the Mental Health Association. Mental health is an important part of our overall health and well-being. It affects how we think, feel, and act. It may also affect how we handle stress, relate to others, and make choices during an emergency. What are some of the healthy ways that we can cope with this type of stress?
It's a really great question, and probably one of my most favorite whenever I have the opportunity to talk about mental health, and that is because when it comes to describing how we feel physically or communicating to a friend or loved one about how we might be feeling physically, we don't hesitate at all to tell people when we have a migraine, when our back hurts, when we have an upset stomach. In fact, sometimes we get a little bit too much information when our staff leave voicemails on why they're calling out sick that day. But we very rarely talk as frequently about how we're feeling emotionally. So one of the first things to do to help relieve stress is to just talk about it. It's to talk about how you're feeling, to notice how you're feeling, to take breaks from upsetting content. Social distancing can take on a new meaning in the sense that it's not just socially separating from other individuals, but it's social media distancing. Give yourself a break from screen fatigue. There's only so much information that we can absorb in our brains. And when we are just consistently infiltrated with messages that are coming across social media, it can be taxing. And then when you combine that with the stress of COVID, working from home, trying to manage your children's on-school or hybrid learning, it can just be too much. So this is also a really good time to take stock in how you are feeling physically as well as emotionally. So take care of your body. Eat right, minimize alcohol consumption. This might actually be a good opportunity to stop smoking and to affect your physical health in a positive way, which will in turn affect how you feel emotionally.
If you have a loved one, for example, having some trouble with maybe anger, anxiety, depression, what should you do?
Sure. Well, the first, we talk a lot at MHA, at the Mental Health Association, about the importance of asking people how they're feeling in order to start a conversation or to start talking. So if you sense that somebody may not be feeling well emotionally, we use an acronym which is ASR. The A is for ask. Ask them how they're feeling. Ask them what could potentially be bothering them. Ask them, you've noticed something different in the way that they're behaving, and you just want to ask them if everything is okay. And then you want to be supportive. So that's the S. You want to support. You want them to know that you are a support for them, that you want to help them get the help that they may need, which then leads us to the R, which is to refer. Refer them to a counselor. Refer them to therapies that will be helpful to them. Ask, support, and respond.
Now, because of the increase in demand for mental health services, some people have been reporting to 22 News that they're having trouble getting an appointment or even access to mental health services. So what is available for someone who needs help right now?
Well, there are certainly, if somebody felt that they were in crisis, there are crisis services that are available in our community. The Behavioral Health Network, for example, or BHN, provides crisis services in our community. There is also the Suicide Prevention Hotline, which is 800-273-8255. And there is, of course, the Mental Health Association's Best Life Outpatient Behavioral Health Clinic, which We are very, very fortunate and always very eager to let the community know that we do not have a wait list. We're able to see people in some situations same day or by the end of the following day. So an important number for people to know would be 844 MHA well.
You mentioned alcohol consumption, and I want to circle back to that because there are numerous studies that isolation and alcohol, the two just don't mix. Are you noticing an increase in people self-medicating?
Sure. Stress during the pandemic, we know, has really led to an increased use of medications, both prescription and non-prescription, illegal drugs, and also the return to a substance when folks have been in recovery for a longer period of time. A recent study from the American Medical Association indicates that as the COVID-19 pandemic continues, so too does the nation's opioid epidemic. The American Medical Association is greatly concerned by the increasing number of reports from national, state, and local departments of public health who suggest that there are increasing numbers of opiate-related mortalities, particularly from illicitly manufactured fentanyl and fentanyl analogs. In fact, more than 40 states have reported increases in opioid-related mortality, as well as growing concerns for those with mental illness in counties and other areas within states.
And it is really scary too, because all of our attention right now is on COVID-19, and we're not hearing about the opioid crisis right now, it seems, but it still does exist, and it's important to keep that in mind.
Very much so.
We will continue our conversation right after the break. You're watching 22 News in Focus.